Good afternoon, everybody. My name is Sally Tate, and I work for Kidney Care UK in the northeastern Cumbria. And I'm joined today with my colleague Adele. Adele, would you like to introduce yourself briefly?
Yes, hi, my name's Adele. I'm a patient support and advocacy officer for Kidney Care UK, and I'm going to tell you a little bit more about what that role involves later on in the talk.
Thank you, Adele. So I'm going to share my screen and I'll get my presentation started. Somebody tell me that you can see that?
Yeah.
Brilliant. Right. So, so we're from Kidney Care UK. Oh, hang on, I'm going to skip ahead. So the purpose of this presentation really is just to give you a bit of an overview and an introduction to kidney disease. So what is kidney disease? We're going to look a little bit at some of the causes of kidney disease. I'm going to outline the main signs and symptoms of kidney disease. And if you are like yourself, if you have experience of kidney disease, is there anything that you can do to prevent kidney disease or slow the progression of the disease as you age? And then at the end of my section, I'm going to hand over to Adele, and Adele is going to give you an outline of who Kidney Care UK are within Northumberland, but they're within the wider region of the northeastern Cumbria, but also as part of the UK. So to start off with, so what is kidney disease? So your healthy kidneys filter waste out from your bloodstream and they balance water and other substances within your body and to maintain healthy and normal body functioning. So in kidney disease, what happens is your kidneys don't work as well as they should do, and this leads to a buildup of waste product and excess water in the body when the kidneys are unable to remove it. So this can happen quite gradually over time. It can take, many, many months, if not years, to develop kidney disease through the different stages, or it can happen quite rapidly, usually after some kind of quite sudden illness, like if you've become dehydrated or you've had quite a nasty flu virus or a bug. So for clarity, kidney disease is also known as chronic kidney disease, which can also be shortened to CKD. So if you see some of our slides or some of the patient information that we have, it might refer to CKD, and that is just chronic kidney disease. So it just means long term. This isn't short term. That it will be resolved within a couple of weeks or a couple of months. This is long term, over the course of months and years. So what causes kidney disease? So the main two biggest causes of kidney disease are high blood pressure and uncontrolled diabetes. So with high blood pressure, what that usually entails is that someone has had high blood pressure for a number of months, if not years. So this is long-term high blood pressure. If you have high blood pressure in the short term, that can be quite quickly managed, quite quickly brought under control. That does not necessarily mean you will go on to develop kidney disease. It's the long-term high blood pressure that will cause damage to these tiny little blood vessels that supply your kidneys. So again, it's about maintaining balance within the body. Uncontrolled diabetes, that is, again, diabetes is certainly on the increase, type 2 in particular. And what we're finding in the kidney world is that the incidence of kidney disease is increasing significantly because of more people living with diabetes and more people not necessarily having it under the control that it needs to be under to maintain kidney health. Some of the other factors that lead to kidney disease are cardiovascular disease, so heart disease, blood vessel diseases, kidney infections, autoimmune conditions, and the long-term use of some medications. So what I'm leading here to is ibuprofen in particular. So that's not if you've had a bump or an ache or a sprain and you've used ibuprofen for several days. That doesn't necessarily lead to kidney damage, but it's the long-term use of medications, for example, ibuprofen, and that can lead to kidney damage. So it's about an awareness of what what some of the risk factors and what some of the causes are. And if any of these kind of resonate with yourselves, with family members, or some of the people that you deal with, then it's about what can we do to reduce that risk. So what is kidney disease? So kidney disease it can be divided into 5 stages. So stage 1 is like a mild impairment or a normal functioning, but there's a little bit of a reduced. It's about how fast the kidneys clean the blood and filter the blood. So stage 1 is usually kind of slightly reduced normal functioning. At this stage, most people wouldn't experience really any signs or symptoms. By stage 2, there's a slight reduction in kidney function, and at this stage, again, most people probably are unaware that they have any impairment to their kidney functioning. By stage 3, it's reduced again, and this is kind of moderate functioning. There is likely that the person would feel some signs and symptoms in association with their kidney function. By stage 4, this is a severe reduction. So this is a point where somebody is probably really symptomatic. They're feeling quite poorly at this stage, and conversations need to then be had at stage 4 about what happens when the kidneys fail altogether, which is stage 5. So that is very severe or end stage kidney disease. Once someone reaches stage 5, they are very sick. They will need to have a kidney replacement therapy. It's usually dialysis or transplant. So those are the 2 main options for somebody who has reached end stage kidney disease. So there's only about 1 in every 50 people with chronic kidney disease who end up in kidney failure. So it's the numbers are certainly increasing because there's more people living longer with diabetes, living longer with high blood pressure. So there's more people with kidney disease, but it's still, the figures are usually around about 1 in every 50 people will need to have either a transplant or a start dialysis. And the most important thing really is to understand is that most people can manage the condition with treatment to slow the progress. So it's not always everybody who ends up developing kidney disease ends up on dialysis or needing a transplant. So what if you are suspecting you may have some kind of kidney disease? What happens is your doctor will need to take a blood test that measures a level of waste. It's a waste product that's in your bloodstream, and it's called creatinine. And your doctor will then look at the results of your creatinine level along with your age, the size, your body size, your ethnic group, and your gender, and they will perform a calculation to understand how much waste per minute your kidneys are able to remove. And this calculation is called an estimated glomerular filtration rate. So it's a bit of a mouthful, but it's shortened to EGFR. So when we're looking at that image of the kidney, and there's different levels, different numbers, so it means what the filtration rate is, or the rate that the kidneys are able to remove waste. So if your kidneys are functioning at 90 mils a minute or more, that's considered normal kidney functioning. Once it drops to less than 15 mils a minute, which is not very much at all, so you can imagine the waste is building up in the bloodstream, this indicates that is end stage kidney failure. So when we're testing for kidney disease, to get a fuller picture of where you might be in those 5 stages, healthcare staff will carry out tests usually on your wee and on your blood. They're looking for blood and protein in your urine. So in your wee, they want to make sure that there is what level there is of blood or protein coming into your urine. They'll also take blood tests. And a blood test in isolation gives you some information. It tells you where your kidneys are functioning on that particular day. However, to really get a very clear picture of your kidney functioning over a period of time, they'll normally check those blood tests again within 3 months before a diagnosis of kidney disease is confirmed. So the signs and symptoms of kidney disease. So a really lovely acronym to help you to remember what the most common signs and symptoms are is to remember kidneys. So K stands for killer cramps. So when I spoke before about the kidneys maintaining balance when they're healthy, so when you start to develop some degree of kidney disease, your ability to maintain balance of lots of salts and fluids and substances in your bloodstream reduces, and this can lead to cramps. Now, mainly it happens in your feet and your legs, but cramp can occur at any part of the body. Itchy skin. So a lot of people will then describe an itch in their skin, but it's deeper than surface level. It's not necessarily just dry skin. It's the itch actually it originates from the bloodstream. It's about, again, this buildup of waste products and toxins in the bloodstream. So the itch can move around the body. So again, one day it might be someone's back is really itchy, and the next day it's their arms, and the next day it's their legs. So the itch is it can be really difficult for people to cope with, because it interferes with sleep patterns, it interferes with daily function if your skin's very itchy. So the D stands for dietary changes, and what this alludes to is that food doesn't taste as it should do. Sometimes food can taste really bland, tasteless. Some people experience a metallic taste in their mouth, or things are very unpleasant tasting. And because of the dietary changes, these taste changes, people sometimes lose quite a lot of weight because they don't eat the same, because they don't have the same enjoyment of the food. But coupled with this is nausea and vomiting. So again, when you have a buildup of waste products in your bloodstream, it just can make people feel quite sick and actually being sick, but very nauseous, which has a big impact on people's appetite, which stops them from eating much, and they lose quite a lot of weight again. So E stands for exhaustion, and this is probably one of the most debilitating symptoms that comes with chronic kidney disease, is the absolute exhaustion that people feel, and it's due to the fact that there's a buildup of waste in the bloodstream. So people aren't clearing out the waste products from their body, and they just feel absolutely shattered all the time, to the point where you wake up in the morning and just want to crawl back into bed because they're so tired. And that has an impact on family life, working life, just day-to-day function, getting washed, getting dressed, creating a meal, shopping for food. So that exhaustion does then have quite an impact on daily functioning. So the Y stands for your wee, so changes to your wee. So one of the things that is visibly noticeable is that if your urine or your wee is frothy, if it's foamy in the bowl, or if you see any blood. So if your urine is in any way other than like a yellow color, there's something going on. It may be that you have an infection, but it might be that there's an underlying problem with your kidney tissue, and blood is leaking into your wee. And then finally, S stands for swelling. So people with kidney disease will experience swollen ankles, swollen legs, a puffy face, but it's things like the hands. And if you find that you're not able to wear your rings, or you have to take your rings off because they're getting really tight, but watches, if you have to go up a couple of notches on your watch strap, that's, if that's to do with being carrying excess fluid, again, because the kidneys aren't able to remove that excess water from your body, so it stays in your body and accumulates as swelling ankles and swelling hands and a puffy face. So I'm just going to show you. So as Kidney Care UK, one of the things that we've prioritised recently is an awareness of chronic kidney disease, that a lot of people don't really know about kidney disease. They've not really heard of it unless they've had experience of it themselves or a family member. It's not widely understood by the general public. So Kidney Care UK launched this Bloody Amazing campaign in October of 2024. So I just want to show you a really short clip of the campaign. So the Bloody Amazing campaign was really designed to get people thinking about their kidneys. And one of the things, and again, the short video there alluded to, was this a 5-minute kidney health checker. And what this is a really quick set of questions. It's an online questionnaire where you go on and you fill in your own details for yourself, and it gives you an indication of your risk factor for developing chronic kidney disease. So it will ask you about if you have high blood pressure, it will ask you if you have diabetes, if you have a family history of kidney problems. So it's not a diagnostic tool. It will not tell you you have kidney disease, but it will tell you if you are at greater risk of developing kidney disease. And it is designed to give you the tools and the information and the language to be able to then go to your GP and say, I'm concerned about my kidney function. I might like to get it tested. These are some of the symptoms I might be experiencing. This is my risk factors. So it's about raising awareness so people start talking about kidney function and start talking about kidney disease, because there's actually things that you can do to reduce your risk and to slow the progression of kidney disease. So if someone develops kidney disease, then there are some different treatments that are available. So if you have what we would consider mild kidney disease, so on that kidney diagram that I showed you earlier, on stages 1 to 3, this kind of early stages of kidney disease is largely managed by your GP. It's down to things like lifestyle changes, really reviewing your personal kind of activity levels, what you're eating, what you're drinking, if you're smoking, what kind of medication you're taking, if anything that is involved in your daily lifestyle that could be reduced or modified will help you to slow the progression of kidney disease so it doesn't move into the later stages, so the more severe, moderate to severe. So with people who do progress into moderate and severe CKD, which is the stages 4 to 5. So this is where people are referred to a kidney specialist, and that's usually at the hospital. So it's called nephrology as a specialty. And for those people who need specialist kidney care, this may include active treatments such as hemodialysis. So that is a dialysis treatment that cleans the blood 3 times a week, usually in the hospital, but is also available at home. There's also a treatment called peritoneal dialysis, which cleans the blood in a different way. It involves using dialysis fluid into the body, and that is usually done at home by individuals, and they can do that during the daytime or overnight. Or transplantation. So you can get a kidney transplant. Now that's not always available to everybody. There is some quite strict kind of criteria that needs to be met for someone to be eligible for a kidney transplant, and that's usually they have to be of a certain level of fitness, and it's not based on age, it's based on general health, other illnesses that you might suffer from, and if possible, there's not a lot of kidneys available. So if you have someone in your family who would potentially want to donate a kidney to you, then again, that increases your chances of getting a successful transplant. But for some people, none of those options are desirable. Sometimes it depends on somebody. If they are particularly frail, they're already got lots of multiple other illnesses, and they may feel like dialysis or a transplant is just not for them, then there is the option to not do that and to have conservative management, which is the management of those symptoms, and it's about treating the individual as a person, and making sure that if they're feeling sick, there's medication we can give for sickness. If they are feeling really tired, if they're quite anemic, then there's treatments that can be given for that, but it's not active dialysis treatment. So if any of this resonates with you individually or with family members or people that you work with, how can you prevent or slow kidney disease? So one of the biggest things really is to managing any of the risk factors. So that would be a pre-existing condition such as diabetes. So a really good management of your diabetes, blood pressure control, and continuously monitoring of that. So not just, oh, I've checked my blood pressure, it's all right, and then forget about it for 6 months. It's about maintaining good practices where medications that treat blood pressure are reviewed on a regular basis to make sure you're on the right dose, and if it needs to be reviewed and increased, then that is done in a timely fashion. As with probably most long-term conditions, lifestyle changes are the biggest factors that are within our control, like as individuals. So if you're carrying excess body weight, trying to lose some weight is a really, really good starting point. Regular exercise, again, it's about building up good muscle and bone strength. People who smoke, encourage them to stop where possible. If people are, consume reasonable amounts of alcohol, can they reduce that alcohol consumption? Can they stop drinking alcohol altogether? Dietary changes, and they're quite basic things, but reducing your salt, not adding salt, avoiding high salt foods, looking for salt alternatives, using lots of spices and herbs as opposed to low salt is not a great thing, not a great alternative for people with kidney disease because of what low salt contains, which is potassium chloride instead of sodium chloride. Reducing saturated fat and reducing sugar intake. So you're trying to give your body just a bit of a hand to be a bit stronger, a bit healthier, and less work for your kidneys. Staying hydrated is so important. There's something that unless you are at severe stage of kidney disease, you would have a very strict fluid intake. But for everybody else, maintaining good hydration and where possible, water, but if not water, then lots of non-caffeinated drinks. And that helps just to keep your blood nice and thin. It flushes through your kidneys. It reduces that risk of kidney infections. If you're prone to kidney infections, you're always asked to drink loads of water. A medication review. So if you want to, if you're taking a few different medications, or if you find that you need to use things like ibuprofen regularly, is there an alternative? Is there something that's a bit more kidney friendly that you could use? Are there alternatives to medication? And pharmacists are an amazing source of guidance with this. It's not necessarily making a point with your GP. It's about getting in with a pharmacist who can look at a list of medications and identify straight away what poses a risk to your kidneys and what else could be replaced. And any other risk factors. So things like family history, you can't change that. That's outside of your control. But if there's certain things, if there's occupational risks that you have, that is, can they be modified? Can they be changed? And it's just about trying to slow the progression of kidney disease if you already have it. If you don't have kidney disease, what can I do to avoid it? So in terms of my part of the talk, that's me done. I'm going to hand over now to Adele, who's going to give you a bit of an introduction to Kidney Care UK within the region, within Northumberland, but actually across the northeastern Cumbria. So I'm going to hand over to Adele.
Thanks, Sally. So my name's Adele Brown, and I'm a patient and support and advocacy officer with Kidney Care UK. So Kidney Care UK is the UK's leading kidney patient support charity. We provide free, practical, emotional and financial support to people living with kidney disease, which is also accessible to their family, friends and carers. The charity has a team of patient support and advocacy officers covering the UK and Northern Ireland, and we play a crucial role in delivering comprehensive support tailored to the unique needs of kidney patients and their families. So myself and my two colleagues in the North Eastern Cumbria team, who are called Natalie Duffy and Helen Richards, we cover the areas served by the renal units at the Freeman Hospital, Sunderland Royal, James Cook Middlesbrough, and West Cumberland Hospital. Northumberland patients come under the Freeman Hospital, which has 3 satellite units for patients on dialysis. One of them is in Alnwick, with the other 2 being in Gateshead and North Tyneside. So the first line of support for our patients is our website, which covers all aspects of living with kidney disease and is a wealth of accurate and reliable information across all topics of kidney disease, ranging from information on the different stages to travelling abroad when you're on dialysis and everything in between. If people don't have access to the internet or would like further information, advice or support, we have a free support line based at our head office, which is open Monday to Friday, 9 a.m. to 5 p.m. So an inquiry may be resolved at first point of contact by our support line staff, but if more in-depth support is required, then a referral will be sent through to myself or my colleagues. We also receive online referrals from healthcare professionals via our website, and again, these are logged and allocated by the support line staff. So on receipt of a referral, we contact the client to arrange a telephone appointment. The aim of this appointment is to identify their needs and to see how best we can support them. They may only present with one area of inquiry, but we take a holistic approach to ensure we address all of their needs, as there may be areas of support we can offer that they are unaware of, and that will normally come out during the course of the conversation. So some examples of the services that we provide as patient support and advocacy officers are information and guidance. We can give clear explanations about kidney disease, different stages and treatment options, and empower patients to make informed decisions about their health. We have almost 60 excellent patient information leaflets covering a whole range of kidney-related topics. These include issues such as understanding your blood and urine results, donating a kidney, receiving a kidney, different types of dialysis, dialysing at home, travelling at home or abroad when you're on dialysis, exercise and keeping fit, etc. The great thing about our leaflets is that the information is easy to understand and not full of complicated medical terminology. So, emotional support. One of the most important parts of our role is to provide a listening ear and allow people to talk about their experience and any worries or concerns they may have, as they often don't get the chance to do this during time-restricted medical appointments. We also inform people how to access our free counselling service, and we can provide ongoing emotional support whilst they are waiting for this to start. We can also refer them to our peer support service, who can connect them with someone who can share their lived experience of kidney disease. Practical assistance. We can guide people through the complexities of the welfare benefits system and help them to understand and access benefits and services they may be entitled to, or assist with cost of living support and provide them with food or fuel bank vouchers, or refer them for further help with energy advice. Financial assistance. We can inform clients about our financial grants. Examples of these include grants for holiday and respite breaks, or to replace broken white goods, or pay for a shed for storage of home dialysis supplies, etc. Employment assistance. We can provide further information on their employment rights and signpost them to other organisations if they are having issues with an employer and need more specialised support in this area. Housing assistance is another one. We can give information and advice on applying for housing and provide letters of support explaining their medical needs and the importance of a property being suited to these needs. For example, if they are carrying out dialysis at home. Health and well-being. We can provide information from our website on a healthy lifestyle and signpost them to our Kidney Kitchen resources. We have somewhere in the region of 200 recipes on the website that are both kidney and diabetic friendly, and we can also send them out our free magazines containing nutritional advice and dietitian approved recipes. Advocacy. As advocates, we can act as intermediaries between patients and healthcare providers, ensuring that the patients' voices are heard and their concerns are addressed. So another big part of our role is visiting hospitals and dialysis units to raise awareness of the charity and the support we can offer to people living with kidney disease. We talk to staff and patients and provide them with a tote bag containing some free gifts and further information on our services and how they can access them. It's always lovely to meet patients face to face and let them know that there is help out there for them and that they don't need or have to cope with the disease on their own. We also attend various events with a stand with information leaflets and free resources and talk to people about the charity and the support we provide and just to spread awareness of kidney disease. So to give an example of the type of support we provide as patient support and advocacy officers, I'd like to share one of my cases with you. I received a referral from a home dialysis nurse for a lady who had previously been working full-time in a professional role. She was really struggling with her illness and experiencing severe financial difficulties due to no longer being able to work. In one telephone appointment, I was able to complete a grant application for a £300 assistance grant and support it with a letter, provide a food bank voucher for her to collect a food parcel that afternoon, register her on the Priority Services Register with her energy providers so she would be treated with priority in events such as loss of supply, complete a referral for her to get help with her universal credit claim and PIP application. I also sent her an email with links to relevant information on our website and signposted her to other organisations for grants. I signed her up to receive our quarterly magazine and ordered her Kidney Kitchen magazines. I then continued to support her with regular check-in appointments for emotional support until her first appointment came through with our counselling service. A little further down the line, she came back to me as she was about to start in-centre hemodialysis due to no longer being able to continue the type of dialysis she was on at home. And understandably, she had some anxiety about this. I was able to do a referral to our peer support service and for her to speak to someone with lived experience who could help her to prepare for this so she would know what to expect when the time came. The client was extremely grateful and felt so much better after speaking to me, as she previously had no idea of the support we could provide, and she felt like her burden had been lifted. It's lovely to be part of such a great charity and very rewarding being able to make a difference to the lives of people living with the challenges of kidney disease and to help make things just that little bit easier for them. So just to recap, you can see on the slide the Kidney Matters magazine I mentioned, which is full of great information for kidney patients, and it's free to either have posted out or can be read online or picked up from their renal unit, as the renal units also tend to keep a stock of them. The next slide shows Kidney Kitchen information on our website. And this is where you can find all of the kidney and diabetic friendly recipes, a selection of which are in our Kidney Kitchen magazines. These are very popular, and again, they're free of charge and can be posted out or read online. The next slide shows the patient information leaflets that I was talking about earlier. They're great, they're full of accurate and reliable information, and again, can be ordered free of charge and posted out or read online, or can be downloaded as a PDF and printed off. The final slide shows our patient support line number and the all-important website address with a QR code which can be scanned to take you straight to it. Thank you for attending this presentation today and listening to the information we have provided on Kidney Care UK. And I'll hand back to Helen for any questions you would like to ask.
That's great, Adele and Sally. Thank you so much for going through that and obviously covering all that very, very useful information. If anyone has a question, could you please pop it in the chat box? And while we're waiting for those questions to come back, I think what I kind of thought about, or what I wanted to know more about, is that obviously those patient leaflets seem really, sort of informative. How much are those out in sort of GP surgeries and primary care settings? I'm just thinking for people with quite low stage kidney disease, if it is being managed, simply by the GP, it seems like there's probably a real need for them to have that information and support, because there'll probably be limited, sort of opportunity for that. So what sort of work's being done around getting out into GP surgeries and things like that?
Yeah, so just the other day, actually, we were at a sort of roadshow, which was all about cardiovascular disease, and obviously the conditions that lead to that, chronic kidney disease being one of them. And what we actually did at that event, we had a stand with all of our patient information leaflets and a banner showing the website address, etc. And we're able to network with a lot of professionals from primary care sector, GPs, and other people in that setting, and just let them know about the type of resources that we have available. So it's all about sort of raising awareness. We explain to them how they can go online on our website and order a stock of these to have in their waiting rooms. So that's it's all about raising awareness, and just making sure that primary care, because obviously people who already have kidney disease and maybe in stages 4 and 5 are aware of where to come to and what's involved with kidney disease. Whereas people, like you rightly say, in the early stages need access to that type of information. So, yeah.
Yeah, no, that makes absolute sense. It just seems there's a real need for it. And I think seeing all those leaflets, will be in touch probably afterwards and asking you to send a stock out to us as well, because obviously we get out and about across the county, sort of quite a lot. And there may well be people, sort of on this call who, would like some leaflets as well. So I know all your contact details are, sort of in the slides that we're going to send out. So there's a few questions in the chat now. Basically, first one's asking, are there any support groups in Northumberland for kidney disease? So are there any like group works that are going on at the moment?
So at the moment, there aren't any support groups other than when you talk about Northumberland. See, we deal with the whole of the Northeast. So we do have the Kidney Patients Associations. So there is the Tyneside Kidney Patients Association, and there's also the Northeast Kidney Patients Association. The Tyneside one supports sort of patients who are under the care of the Freeman Hospital, whereas the Northeast one supports more sort of Sunderland and James Cook areas. So the kidney patient associations, people can get in touch with them, and they can, give advice and help around kidney disease. And pre-COVID, they used to have more events going on. People could come along to more sort of face-to-face events. And unfortunately, I think during the course of COVID, things like that have sort of slipped away. But it would be nice to get things like that sort of back into play, But at the moment, unfortunately, we are a little bit restricted on sort of patient support groups. Would you say, Sally?
They're very much I was just chatting to a lady yesterday about it, and I think there's like with the use of Facebook, there's like closed Facebook groups that people can join, which is great, but that is online. There's a significant proportion of the population who are excluded if you just have online support groups. And I think the very nature that a lot of people, if they are a bit older, they're in a rural area, they're quite isolated, the opportunity to meet up with other people experiencing something similar to themselves is absolutely, it's so important. But those don't necessarily exist, I think, because until you start raising the awareness of kidney disease and you see the extent of kidney disease across like a particular location, and then from that becomes those support groups. So if you had, if you talked about diabetes, well, there'll be lots of different diabetes support groups. There'll be lots of different cancer support groups and drop-in sessions. But actually, kidney disease has been one of these conditions that is just not really it's not widely understood. It's not widely talked about. So that's one of the things that us as a charity it's certainly our ambition to get things like this more well local to people. It's great that you can access things that are online, but that doesn't help you if you just want to meet somebody who, how do I manage a kidney friendly diet, how do I cope with the challenges and the changes to my body, my inability to work, or if I am, if I'm already retired, your inability to do the things, the hobbies that you've always wanted to do, because exhaustion and some of the signs and symptoms of kidney disease prevent you from doing so.
Yeah. No, thanks for that. And as you say, you have got, sort of the peer support available, I guess, on that one-to-one, sort of
Yes.
through the helpline. There's another question around where the majority of your referrals come from. So is that kind of self-referrals, professional referrals? How does that come in?
So basically, we get a mixture of referrals. We get a lot of referrals from healthcare professionals. There's a healthcare professional referral form on our website, which they fill in. So that it could be from a renal social worker, it could be a home dialysis nurse, it could be a nephrologist, basically any level really. They can put a referral through. And that goes to the support line team at head office. And they are the ones who would then allocate that on the system to whichever area of the country it's for, to a person like myself to then get in touch. And the other way we get referrals are self-referrals. So basically people who may have been on the website, seen the information, have further questions that they'd like to ask, or they may have attended an event and seen our advice, our leaflets and our banner and just want a bit more information. Or it might be a patient that I've spoken to in a renal unit when we've went out and delivered the packs and given them information and advice. They might have took that away, had a look at it, and then had a bit think and thought, oh, I want to get in touch with them to find out this, I need help with that, whatever it is. And then they'll come onto our support line, or they can email us, and then we'll get in touch with them. That'll be allocated to us from our head office.
Great. The next question is, are there only 1 in 50 people that will need dialysis from all stages apart from stage 5? Can you just explain a little bit more about the 1 in 50?
So if you had 50 people who developed stage 2 chronic kidney disease, then one of those people over the course of, and like kidney disease can progress over years. So with our Bloody Amazing campaign, there's been quite a lot of testimonials where people have developed chronic kidney disease, the later stages, they might have been aware of it at late stage 3 or stage 4. And when they've actually asked the questions, they've gone back into their medical records, and maybe 5, 6, 10 years previously, there was some dysfunction with their kidneys at that point, but it was not raised to them. It was not, they haven't developed any symptoms, and they have continued to live their lifestyle. So the figures basically are, for all of, if you took 50 people were diagnosed at early stage kidney disease, 1 out of those 50 would progress through the stages 3 to 4 onto stage 5, where they would then have kidney disease, because of the way that we age, the way that kidney function deteriorates with age anyway, and often people will die of something else before they get to that point where kidney disease is going to be the biggest issue in their lives. So for example, my mother, she has recently has had surgery for something else, and and I noticed on her discharge letter it was CKD stage 3, and I asked her if anybody had mentioned anything about her kidneys, and she said no, nothing. And I said, but that's on your discharge letter, like. So that's an issue, and this is where raising awareness but it is with patients, it is with service users, it is with the general population, and it's also with healthcare professionals. Primary care, absolutely, but also secondary care, discharging people home with a letter with not any kind of follow-up information or even a link to a website. Here's chronic kidney disease diagnosis on your letter. For more information, see Kidney Care UK website to understand what that is, to then be able to bring up that question with your GP and say, so what does this mean and what can I do about this?
And it's so important to have that trusted information because,
Absolutely.
and actually have a reliable, website, because I think we all Google things and then things come up, and actually to have like a, sort of that set thing of saying, listen, this is a trusted source of information.
It's about empowering people to be able to know where to get that information. I think maybe it's been a generational thing, but again, my mum wouldn't dream of of challenging the GP and saying, well, what's this? You know, she wouldn't dream of doing that. Whereas actually, if you're given the tools and the information and the knowledge, and even, you know, like a link to where I've done this online kidney health checker and it says I'm high risk. So what does that mean? What can I then do about this to reduce my risk or to slow the progression? Because once you start with the progression of any disease process, you can't stop it, but you can slow it right down. So when we talk about moving through the different stages from 1 to 2 to 3 to 4 to 5, that is that progression is happening. There's very little you can do to stop it, but what you can do is go, well, maybe I need to adjust my lifestyle, and maybe I need to lose some weight, maybe I need to stop smoking, I'll get my medication reviewed, and you know, take that kind of holistic approach to your health, but with a focus on your kidneys.
That's great, thank you. Couple more, there's quite a few comments coming in and questions. So this is from the Stop Smoking service in Northumberland, and it's really an offer to say that, you know, would it be helpful to send like sort of contact cards, because obviously you might be coming in contact with patients wanting to kind of stop smoking. Likewise, I would imagine.
Brilliant,
You know, sort of the link
absolutely.
to. So
Yeah,
perhaps what I'll do after this is put you and Brenda in touch with each other, and, you know, sort of you can obviously discuss that kind of between
fantastic.
yourselves. Happy to do that. There's another question in here just saying thank you for the informative session. Had no idea all the support was available. Never been informed of this by the GP surgery, as we were just kind of discussing before, or what can be done to kind of slow things down. Again, what you were saying, got letter with CKD on from GP surgery, had no idea about it, and will be promoting the support available to colleagues and family and friends. So that's really, really, you know, sort of good. A question around, what does it mean when you have cysts in a kidney stone? Is that something slightly different from
cysts and a kidney stone, or cysts or a kidney stone?
Cysts and, this says.
Right, okay. So cysts, so my understanding of polycystic kidney disease is the development of cysts within the kidney tissue. So if you've got like a really lovely, I don't know if you've all like seen a kidney from the butchers, you know, like it's really nicely tightly packed together kidney tissue with all these functional units that do the filtering of the blood. But if you see like a cyst, then they're just like a big empty space, or like a big bubble. So what that does is it damages that kidney tissue, so it reduces the number of functioning units within that kidney. So you're reducing your function if you've got lots of cysts within a kidney. If you've got a kidney stone, so that is an accumulation of like salts that begin to crystallize. Now it depends on what the salts particularly are, and there are different kidney diseases that can predispose you to developing kidney stones. It's very much a case of working closely with your GP or with a urology department at the hospital to understand what your specific risk is with developing kidney stones, and what specific things you can do to reduce the development of those kidneys or to keep them small. Because the problem is, if you develop a kidney stone, I mean, I've never had one, but I believe they are excruciatingly painful when they start to move, and they can cause real significant damage to the kidney function, the kidney tissue, because it essentially blocks the tube. So your kidney's creating all of this urine, it's creating all of this wee, but it gets stuck in the tubes and backs, you know, there's like a backflow back into the kidney tissue. So so kidney stones and kidney cysts are quite different things, but they can both be really quite damaging to kidney tissue itself. So if you've got concerns, it's about seeking that guidance and that advice from, you know, those people, you know, like specialist services. If it's a kidney stone, you know, what is it that's causing you to develop stones? Because not everybody develops kidney stones. What is it about your diet, your lifestyle? Are you predisposed? Is there a family history? Is there something else that's contributing to the development of these stones, the creation of the stones?
Thanks. Is there further information on your website about things like that? Or
there will be about about polycystic kidney disease. I'm not sure. There will be something about stones. I haven't seen the leaflet particularly on stones, but yeah, in terms
Worth
of,
having a look.
it's worth having
Yeah.
a look to see it. Again, it's about modifying your diet and your lifestyle, drinking lots and lots of water. It's about, preventing crystals from forming, because once those crystals are formed, then they start to kind of stick together and then form into a stone. So yeah, it's about making sure that you're well hydrated, and if there are particular things that you are eating that are going to contribute to you creating these crystals, this crystallization of these salts in your bloodstream, then it's about modifying those aspects of your diet.
Thank you for that, Sally. That's really useful. And there's just a few kind of comments around, obviously it's been a disease that, people don't understand and downplayed. And if, one that's saying, obviously, if they'd recognised the symptoms earlier, would have had it diagnosed earlier, not be in such an advanced stage.
Yes,
They would
absolutely.
stage 4
Yeah.
when diagnosed. Someone that's saying support groups would be, sort of so useful. And I guess on a similar vein, someone saying, would you have, for example, a register of people with lived experience who'd be willing to talk to newer patients? I guess that's about, sort of that peer support, isn't it? And maybe using volunteers. Is that something that's kind of been thought about?
Yes.
Maybe is the offer that might be expanded sometime in the future?
Yeah. So we do, at the moment, we do have peer support network that has started off based from one of the London hospitals. With Kidney Care UK, we've set up this peer support network, and we have volunteers who all have lived experience of kidney disease, whether it be they've undergone a transplant, they've done hemodialysis, peritoneal dialysis, whatever stage, And we're really lucky, actually, because we're just being able to sort of expand this into the Northeast. And we've literally just recently advertised for a peer support coordinator for the Northeast. So they will be based in this area, and they will be working with the hospitals that we've spoken about within our region and coordinating volunteers to talk to patients and to share their lived experience. So yeah, we are working on that. It's an important part of a direction that we're going in.
Yeah, no, that sounds really, really good. So there's a question, I guess, about if someone's young and already in a later stage, is the percentage of people progressing to dialysis much higher? Is there any statistics around that on your, sort of website, or that you can, sort of provide?
For younger people, there's not a huge number of younger people who are, it's usually when people who are diagnosed with kidney disease, and it's not related to age, progression, lifestyle factors. It's usually, if they're younger, it's because there's some kind of fundamental disease process with the kidney. So it might be that there's been some family history. It might be that you've developed kidney disease from a very acute illness. So we don't have specific statistics. What we do have is a young adult kidney support group, and they have that's available for people aged 18 to 30. It's largely a closed Facebook group, but it's about being able to get an understanding of a cohort of people who live with kidney disease. And some people were diagnosed as children, as babies. Some people were born with one very poor kidney, so have been a kidney patient for the majority of their life. But then again, if you've got people who are into their 20s and 30s, there's a number of people who have an underlying condition that they're not necessarily aware of until something happens. And it's often like a short-term illness, a viral illness, a viral infection, or and then they have a blood test, because young people, unless you're poorly, you're kind of not really engaging with services in the same way, and it's only off like a blood test that would trigger the hang on, your kidney function isn't as it should be for your age, your lifestyle, and all of those things. And it's at that point that these diseases can be diagnosed with like a biopsy, and it might be there's something that somebody's just lived with for all their life. But some extra illness has just kind of tipped that kidney function to a point where somebody starts to feel symptomatic. So like I was saying before, that your kidneys are amazing. I mean, most people have two, but some people are born with one kidney and they don't know they're born with one kidney until something happens to that kidney, and then they get investigations done and then they realize, oh well, actually, did you know you've only got one kidney? Well, unless somebody tells you and has looked for it, like, how would you know? You wouldn't know. So
I think we'll have to. I'm just very aware
yes,
of
sorry.
time, and there's quite a few more questions which we might have to, sort of come back to people.
Okay.
I guess that particular question might be more around I guess a concern that if they're already at a late stage, how likely is it going to be that, sort of it would go to dialysis stage? I guess, is it fair to say that if we've got your contact details, can that person, contact obviously Kidney Care UK
Yeah,
to
absolutely,
talk
no
about some of
problem.
those
Yeah, absolutely
concerns?
no
Because you might
problem.
not know,
Yeah,
sort of obviously
yeah.
those
And
specific
unless you're
things.
dealing very specifically in like with a one-to-one person on a clinical point of view, do you know what I mean? Like we can certainly
Hard to
give
say.
you guidance and advice and support and counselling through that process, but we can't say, oh yes, you're absolutely going to develop stage 5. It may be that that isn't the case for that
Whatever
individual.
happens.
So
Thank you. And just someone saying, obviously, there needs to be more awareness, sort of within HCPs, and, you shouldn't kind of just find out by letter. There's a couple of questions around, I guess, obviously, how people hadn't necessarily been aware about the dietary side of things, sort of maybe looking at throwing away the salt and any, sort of caffeine drinks. Someone that's previously trained as a general nurse and has actually got a lot out of the session, which is great. Someone's asking us if it's okay to keep drinking kind of green tea, trying to cut back on sugar and reduce, sort of cola and cocodamol. Unsure if you take apple cider vinegar. Is there some specific things that you can think of on that, or is there stuff on the
well,
website?
I mean, I haven't seen anything particularly to say apple cider vinegar is not a good thing. I think if there's nothing in all of the leaflets that we have relating to diet and lifestyle and guidance with that, everything's been passed through the UK Kidney Association and the British Dietetics, so the real dietitians. There's nothing that I've seen or heard about not drinking green tea, and nothing I've seen or heard about not taking apple cider vinegar. But do your own, make sure you do your own research before you're ensure you carry on if you think it's doing you some good.
So if you've got like a link to sort of dietary advice, because that seems to be like a real theme in the questions, can you maybe send that to us if it's not already in the slides, and we'll make sure that we get that sent on, after
what I
the
would
event.
say to everybody who's on the call, if you've got lots of questions that relate to specific issues for yourself, for family members, or for people that you're working with, go to the website and navigate your way around, because honestly, the information's amazing. About dietary advice, there is so many. There's patient leaflets on it, there's the recipe books that you can order, there are lots and lots of information about things that you can do to slow the progression, things that you can, if you've identified some issues with your own like diet and lifestyle, that you can, maybe I can reduce that. So I would, rather than kind of giving you another point of contact to get in touch with, like, I would go to the website, and if you need to talk to a person, then ring the number. You'll get through to Adele or one of our colleagues, and certainly we can point you in the right direction.
Yeah.
Thank you so much, everybody, and we're getting a few thank yous coming in. I'm sorry we haven't got a little bit more time, because I'm sure that it's something that we're going to kind of keep on talking about.
Oh my God, yeah.
Definitely. So thank you so much for everybody. Thanks to Sally and Adele for giving up the time today to come and talk to us, and for everybody else for coming along to listen and to really engaging with the session and asking so many really interesting questions. It's been, sort of really great for us as well. Please do, we will send on the slides, as Tim's kind of put in the chat, that will have obviously all of the contact details on there. And just keep an eye out on our website for any future events that we're holding. These do take place, sort of every month, or feel free to sign up to our newsletter, and everything's contained in there. So nothing else to say other than to say thank you, and I hope everybody has a lovely weekend.